We have about 40 minutes left in the show. You listen to Planet Green Choose. The call number is 1-347-326-9626. I do believe we have our friend Hunter Holliman. Are you still there, Hunter?
Yes, sir. How's it going?
Very good, thanks. And thanks for coming on the show again. I know that you're working out of Washington, D.C., and you are also working the Michigan ASA chapter. And you had the pleasure of being at these US Senate Judiciary hearings, which is a significant moment, I would say. Tell us what your impressions of it was.
Absolutely. Let me first off go ahead and say, Robin Schneider, you are a superwoman. I can't believe you're back at work already, and thank you for giving ASA the opportunity to talk at the NPRA fundraiser this weekend. We are thrilled to be there and be supporting 4271. The hearing on Tuesday, I mean, it was certainly a historic event. The outcome probably wasn't to my complete liking, and probably many advocates that are listening right now. There was actually a big hearing that day on Syria. The president was giving some Senate testimony, and so only 4 of the 17 members of the Judiciary Committee could make it. We had Leahy from Vermont, who's the chair, Grassley from Iowa, who's been a long-time opponent of marijuana and medical cannabis, Whitehouse from Rhode Island, a medical cannabis state, and Blumenthal from Connecticut, also a medical cannabis state. So we didn't have any Feinstein, Durbin, Hirono from Hawaii, who's actually been very, very vocally supportive of cannabis and medical cannabis, and no Franklin. So it was quite interesting. I thought that Deputy AG Cole showed a lot of nuanced understanding about the situation that the Department of Justice is in. He stated on more than one opinion that DOJ recognized that going in and just attacking the regulatory system of Washington and Colorado would just lead to a totally unregulated black market, and they seem to be, at least at the higher level of the Department of Justice, are thinking things through and rethinking their tactics. So this whole shift in policy is absolutely welcome. But, if you read through the Cole memo and his new 8 guidelines, there are many, many loopholes where, these are non-binding guidelines, and DOJ reserves the right at any time to not abide by their own guidelines. And, in fact, the U.S. attorneys in the various states still have full discretionary powers as to who they're going to prosecute. So despite, some really nice testimony from Cole, Whitehouse picked up on a few interesting things, actually asked about the nuances between the first Ogden memo, Cole 1 and Cole 2. Even Blumenthal seemed to be really on board. The panel was stacked pretty heavily as far as witnesses go in our favor. There was really one strong opponent of ours, Kevin Sabat, the infamous Mr. Sabat, who was charming as always, but he's there to raise some hysterical arguments against us. Thankfully, Grassley didn't really bite on Sabat's arguments too much and seemed to be really restrained and not get into some of the hyperbole. So overall, some of the main issues that were raised were banking issues. Everyone that spoke really touched on the banking issues where, banks, because of federal government, don't really want to,
participate.
Yeah. They don't want to be perceived as laundering money from a from a drug dealer, which is what they would be doing according to federal law. But everyone kind of picked up on that. They also picked up on the newest trend of businesses having to go to cash only because of both the banking issue and the armored car issue, where Durbin Armored Car Services has actually in California refused to work with medical cannabis businesses. The other thing actually that was really interesting, that in addition to the 8 guidelines that the Cole memo names, everyone on the Judiciary Committee kind of asked for metrics and said these guidelines are great, but there's still a lot of wiggle room when it comes to these, and for states to absolutely know that their marijuana program is acting in strict compliance with the guidelines, and as legislators are trying to put these robust regulatory schemes into place in good faith, it would help a little bit more to know exactly where those lines and boundaries are.
Let me ask you something. I think this is especially in that moment, because we're beginning to see, in some of the questions that were asked, you begin to see some of the vision, per se, of, what the federal government might do. And I think all of this is really to try to figure out how to make people feel safe. I mean, that's the position that I know Leahy's very, they're good answers. It's good that someone's taking responsibility to, try to get answers from the federal government. But, there is still many, many issues that exist. I mean, we of course, taking baby steps in one particular direction, but some of the decisions when they're made could, change all that had gone on up until that point. I say like the X factors when the federal government takes some action. I mean, they could take this position. They haven't stopped viewing cannabis differently than they did before. It still has no medicinal value, and they still consider it. This is just a policy change. But, when and if they act, and no one knows when that's going to be, the discussion's beginning. There's some vision out there of how it's going to be. You are at a perspective that you can see nationally what the trends are and how different states and how other legislatures are acting and what's more amenable to a community or to a county or a state in terms of who's growing the marijuana. As we had on before with Rep. Irwin, the battle, I think, as this bill 4271 exists, is who is going to be the persons allowed to supply and potentially earn a living lawfully by depositing money, paying taxes or whatever. Is it going to be ultimately, and it's for this bill or even the long term is what I'm saying, because it's a challenge to be able to have a good regulatory system with the traditional caregiver model. And I think, just generally speaking, it's an easier sell to, a law enforcement mentality if you have it centralized and you have a number of them and they can be monitored. So where do you see this issue going? I mean, I know Michigan, has a way that it can go. Where do you see that? And then nationally, where do you see that developing, in that those two competitive growers, the two or manufacturers of the medicine or recreational fund?
Yeah, it's interesting. One clear thing that the ASA staff walked away from this hearing in particular was that there are 3 states that are really under the gun right now as far as having a medical program but not having a dispensing or provisioning program in place. And that's Washington, that's California, and that's Michigan. And you can say Montana as well. And I think the fact that, I'm sure we could argue whether 4271 is as robust as Colorado's medical program or as robust a regulatory scheme as 502 is, but the fact remains is that it really does fit a lot of, it fits the bill for these 8 guidelines for coal. And it's great that the state is in a place right now where there is legislation drafted. It's already spent some time in committee and should be going to a vote in the House fairly shortly, I would expect. And that's a lot better place than you could say California or Washington right now. So ASA has been supportive of 4271 since we first saw the first few drafts, and it's not a perfect bill. No legislation is perfect, but we think it's a good fit for Michigan at this point.
Understood. Do you think, as is, would it pass the Cole Memo 2, or do you think that it needs an additional layer of like a regulation committee, board or administration that's more supervisory? Let's say it passed today. Do you think that it would exist in a way that would in an unambiguous way, or as close to unambiguous as possible, meet the criterion of the especially after listening to the Senate hearings?
I think that it would, and again, I'm sure there are people that would object to that. It's hard to tell not knowing the metrics that the U.S. attorneys will be using to ensure compliance with the guidelines. So there's still kind of that gray area, but having it in place, I think, is a major step forward in getting the monkey off your back. And that's not to say that Michigan doesn't have a contentious relationship with their U.S. attorneys, and that in places like California and Washington, we've already heard their U.S. attorneys come out and say that they'll continue to prosecute regardless of the guidelines. I do think it's important to get this on the books, and if it needs some tinkering next legislative session, then so be it. I mean, that's legislation. It's a work in progress, I guess, right?
That's right.
Didn't Cole say that they would not win a preemption argument? They didn't feel as though they would, and so if they challenged the regulatory system and took it down, they would be left with no regulatory system at all. And he even said like a bad regulatory system is better than none at all, or something to that effect.
Absolutely. Yeah, you hit the nail on the head there. They want to see some good faith from the states, that they are trying not to they're trying to prevent medicine from getting into the hands of minors. They're trying to prevent exporting from other states, and having any type of regulatory scheme in place is going to be better than nothing. And, that's not calling 4271 a bad regulatory scheme. I think it fits Michigan fairly well for, the issues that Michigan faced.
Here's a question. There's obviously that we keep saying the word, some kind of regulation on paper and also in effect, and we'll decide what it is and what isn't, so they say. But do you see the, nationally, is the trend that the states are, in fact, embracing the concept that they are going to somehow be involved with the regulating of the growing of marijuana? Is that something? I mean, is that and is that what we're really saying? In terms of, at the end of the day, is it, as a government, whatever the government's doing, whether it's an administrative agency, a quasi-administrative agency, they may have like some people from the cannabis community and people from the Department of Health, even not even a police force, not law enforcement, some other agency. I can even foresee it being something like there's privacy issues, like if they're going to inspect or regulate or look or watch or see testing be approval or whatever it may be, there's rules and penalties that go along with that, similar to the penalties associated with disseminating patient information from the registry. It would be sworn. But, at the end of the day, as the government, I don't know if Michigan is, what's the feeling in Michigan, and what's the feeling when these, if that's the future of regulation, do you see these state governments, embracing the task and using resources to, create an agency? I mean, it's almost like creating, like, for example, like a gun board or something like that, then regulated throughout the state. I mean, it's going to bring in revenue, but it's a whole thing that at a totally different level. But do you see that as a trend, or?
I definitely do see it as a trend. Something that, Americans for Safe Access believes very strongly in is that patients and medicine shouldn't be taxed. But that being said, that's something we've had to concede in a lot of states to get the political will to, actually draft the legislation and get support for it. I definitely see this regulation and taxation model popping up a lot more frequently than, say, a decrim model. And, that's another thing that Rick and Jamie and I were talking about earlier that we had heard from the hearing on Tuesday is that the government wants to see regulations. They don't want an unregulated market like a decrim model would provide. And that, I honestly do see not just a trend of regulation overall throughout the country, but a trend of tighter regulations. We've seen Illinois pass this year, easily the second most restrictive state as far as medical cannabis, next to maybe D.C. Things seem to be tightening up a lot. You see a lot less grow your own because it's much harder to regulate and track. States really want to be able to do this seed to sale model that Colorado's been espousing, which is extremely difficult logistically and honestly fairly impractical.
But correct me if I'm wrong. I just want to ask you a factual, anecdotal fact. Isn't it true that even though that appears to be the model of choice that's being pushed, and the reports on the regulation personnel and the reporting of the regulation was just a total failure, like they were given grades of E's and F's? Wasn't there some kind of, mismanaged and not, even though maybe that's what they were referring to, even a poorly regulated market, or is better than no market? I mean, is that true? Do you know have you heard any reports on that? I thought I had read something somewhere.
Well, you could use Colorado as an example.
That's what I was saying. That's what wasn't the report. Yeah, go ahead.
Where they, they supposedly have this really tight regulated for-profit model with a oversight division and enforcement, and the way their program was written, they just never had the funding to do the oversight properly, and so you see a lot of export to other states. This is something that Senator Grassley was really concerned about, and all that being said, Finlaw, who is Colorado Governor's chief legal advisor, something to that effect. I mean, he came out and said it. He was like, we could have done a better job here in Colorado with the medical marijuana oversight division. But at least we had something in place, and it seemed to appease the U.S. attorneys and DOJ a little bit, where they didn't see as many raids as Colorado. Or as California.
Right. I mean, when they say that, I guess that's who they're really talking to. It's got to be effective both on paper. I mean, now that you've described it that way, it seems like they were talking to Colorado in the memo. It's got to be, whatever the wording was something effective. It's got to be effective on paper and in reality, something like that, where it's actually working. It's not just, and that's the example. But anyways, I interjected there because I had read the same thing and heard the same thing. And go ahead, but you were talking in another direction when I jumped in there. Do you remember where we were?
Yeah, where was I?
I don't know, but it's all good. We were talking, I think, about the government's desire, whether it's appealing to the government to be involved in the cultivating and the selling of cannabis.
What about state-run dispensary systems?
Yeah, that's what we're talking about. Is that a thing? Well, that's like Arizona's more of that. Isn't Arizona's program, you get dispensaries, the people can't grow, it's being fed by...
No, I think it's private, maybe New Jersey Is
Yes,
New Jersey
the dispensary.
a state-run dispensary?
But what do you say about that? Because I mean, obviously, you know, as this moves forward and evolves, they're coming up with, you know, trying to figure out from the last one. I mean, I heard Washington D.C., for example, did not, you know, they don't give out the list of the physicians who are licensed to provide recommendations. So that to me is a reaction to like the Montana story, you know, and all that chaos of the criticism of the, you know, doctor recommendations, maybe even a little of Michigan, because that's been, you know, that's one of the bills that was amended suggesting that it needed to be tightened up or whatever. And then you see Washington, D.C. have a real restrictive, you know, access to the physicians. Am I right about that?
Yeah, absolutely. I mean, that's a major issue we're dealing with. There's only about 24 registered patients in D.C. right now, and they have three dispensaries open waiting for patients. They have 3 cultivation centers producing medicine legally, and the bottleneck is because there aren't doctors out there that are willing to recommend, and they make the whole process a crazy bureaucratic nightmare, of course, for doctors. Yeah, you know, in places like D.C. and New Jersey, I guess you can see it 2 ways. You can say, wow, they're doing a great job at preventing diversion. Or you can say, wow, they're really not serving too many patients. Yeah. And, you know, they're both valid views. I certainly align myself with the latter view. Because New Jersey has, one dispensary open, and there's a 3-week wait to get an appointment. And they're just now talking about their 2nd dispensary, and the D.C. has no patients to serve their 3 dispensaries.
Yeah, it's. I mean, I do think that I mean, you can see it's reactionary. You know, the D.C. situation right now is completely, in my mind, reactionary to the negative overtones of the pot culture associated with the medical. And I'm not against the pot culture at all, but I'm just saying that was always something that was a point of contention. You know, getting in a debate with someone, they pull out the back of a rag magazine that's got a picture of a sexy nurse and come get your certifications. Like, that's just fuel for the fire of, you know, mocking the program and delegitimize it. You know, whatever your intentions may be, it's just I mean, I just think that D.C. is the, you know, example of a reaction to that, into the complete detriment of the patient community. But it probably won't last that long. I think there'll be some common sense and people, you know, physicians seeing it as a market for them to potentially involve themselves. So what's your feedback on 4271? Do you feel that it's getting momentum? Do you think there's some specific things in it that may need to be adjusted? I mean, I understand your point that, like, and that is a consistent national view, I think, amongst most activists, you know, in all states, that, you know, every time you get a positive legislation at all in any way, it's moving the ball forward. Anyway, you know, get people to vote on it, it's good. You know, and it may in some instances give clarity to law enforcement, which may lighten up. You know, a lot of people said that about the amendments this last year. You know, Tim Beck often will say, you know, now that the law has been cleared on these things, whether it is or not, you know, when the legislator acted, it kind of reinforced the initiative as the law, you know, and they you know, the things that they didn't get rid of still existed. But what do you see, you know, being, you know, for 4271 of moving forward, or what changes, you know, may take place?
Yeah, you know, my biggest beef with 4271 is that it does allow municipalities and townships to ban. That is something that we've been fighting really hard in California legislation, where they're county by county, and really, to me, that's the big major flaw. I think that, and listening from Rep. Irwin's talk earlier, it sounded like you know, him and Rep. Colton have some amendments proposed that will fix some of the minor issues, like the cultivation issue, that have really popped out. But you know, overall, it seems like a timely piece of legislation and something that will greatly serve the patients. especially in light of the McQueen decision.
Yeah, it's going to be interesting to see. I was curious amongst, maybe you can even attest to this just on your, get your finger on the pulse, more of a nationally. What was the reaction of some of the other medical marijuana states, with the recent announcement by the Holderman? Was everyone seeing it the way I agree with you. There's a lot of caution that should be taken, and it's a very, could be even called a trap. But is the national trend of legislators and states that have, passed medical marijuana are looking to, did this signify a big moment in, the direction of some of the states?
I think so. I mean, obviously, we would prefer less rhetoric and more changing of laws. I think that would go a long way, and I think that unfortunately, the medical community has been burned before with the we'll call it a policy shift between Ogden and Cole one. So if I were talking to maybe not legislators but potential investors in the medical cannabis industry, or I guess recreational industry, I would give them a fair warning and give them a history lesson and say, we're hoping that history does not repeat itself here. The guidelines are just that. They are non-binding, and although DOJ seems to be understanding the consequences of their really poor choices for prosecution tactics, that it's overall positive, but just to be cautious about it. Keep your eyes dotted and T's crossed.
Let me ask you this. The other states who have had medical marijuana laws, most of the news that you hear about is when the feds raid them, And knock on wood, Michigan hasn't been too devastated. But, there's been some very significant ones, and obviously, just tragic circumstances. But we don't hear about it the same way that, the DEA is going into California or Montana or some, even Washington State and some places in Colorado. But I'm curious if, Michigan's had a really tough time just with the state law, in the state law enforcement community and lack of, the protections being honored. Would you say that other states have, all go through that same experience? Or is it really more, like I sometimes see as being political, whereas like the leading agent in our case is someone who's obviously against it and has set the tone. What can you say about that from a national perspective?
I think that Michigan has the pleasure of being in what I consider maybe the first round of real medical cannabis laws nationwide. The MMMA kind of follows 215 in that it is fairly ambiguous and leaves a lot to be interpreted to rulemaking or the courts. I don't see that happening as much in this, second generation or third generation medical cannabis laws. I do feel like we'll see a lot more regulation built in to future legislation in states that are passing it. I think that even though Massachusetts has had a really great go with handing over the rulemaking to their Department of Health, I don't see as much deference given to state departments in the future to do the right thing like that. And I think that maybe DOJ would prefer to see things really to see the tighter regulations in the legislation and not leave it up to rulemaking as much.
All right,
just to clear up the ambiguity.
Understood. Final question. Obviously, there's the federal forfeiture laws which apply That's a law that's applied nationally. But as we were talking with Rep. Irwin, what I suggest is one of the things that has stood in the way of the successful implementation of the Michigan Medical Marijuana Act, and that is that the crime or the arrestability of the patient or caregiver rests upon strict compliance with Section 4. So it provides an opportunity for, if and when a finding or declaration by a police officer that someone does not and is not entitled to immunity under Section 4, they're then subject to the forfeiture laws. I know all states have all the drug enforcement, all states have forfeiture laws, and Michigan's I think are the most draconian, or in the top 5, statistically. But obviously these other states have gone through the same struggle, of disincentivizing the law enforcement community from, staying in this game, kind of backing off. And, I'm suggesting that, with some time, there's been less and less desire of state law enforcement agents to really be, digging in still, and it will end. But, how have the other states dealt with that issue, especially in relationship to state forfeiture laws? How do you say to this group of people, look, you used to get a lot of money. They used to, get your cars, new equipment, and new weapons, and bulletproof vests, and the helicopter. Of course, the helicopter, got to pay $2 million a year for the French helicopter that we have that we need because there's a war going on in Oakland County, just in case we need to, But the point is, the forfeiture law problems. How have other states dealt with it?
Lots of litigation.
But not a lot of reform. Not a lot of reform.
No, you really haven't seen a lot of strong state level reform as far as civil asset forfeiture. And in that article that was it Rep. Irwin had referenced from the New Yorker last week was absolutely fabulous. I really recommend going back and reading that. For those that aren't as familiar with the asset forfeiture issue in America today, it's really just a great scam. I would like to see a lot more political will to fix the issue, because a lot of times there isn't much recourse for someone who's had their assets seized. In California and now in places like Arizona, we're starting to have some success with having evidence returned, actual medicine, grow lights, and such. But when it comes down to cash, cars, airplanes, helicopters, there's you're going to spend a lot of money trying to get your stuff back, and it just goes right into the pockets of law enforcement. So the whole incentivizing, breaking Fourth Amendment rights is just ridiculous, and it's something that really needs to be examined at the national level too.
Agreed. I think it's. You really cannot have a sensible reform of any kind of marijuana laws. It really they have to be. There needs to be as much activism. Because the principles that remain with the forfeiture laws is that there's monetary incentive, and let's not kid ourselves. Like, the governments have to operate, they got to get paid, they have to make their money, and they have to make sure that their budgets are being met. And now, when I was referring to a helicopter, you didn't understand the reference, and it was my fault. Oakland County, I don't know, a relatively successful financially, national county has a helicopter, that I think they paid $2 million to house. My comment was, why would we have, who's going to war in Oakland County that we're going to need I don't know, but that's kind of the concept, and we have moved to this more militarization, and I don't know, I just, it's fascinating, and I think that it is the next round. I think we need to have more of a discussion about the forfeiture for some of the stuff to work. But anyways, listen, it was fantastic talking to you, and it was fascinating. We got to get you back on, and want to hear about how things progress at all levels that you're involved with. Any final thoughts?
I did want to give some shout-outs again to the NPRA fundraiser. I know not to beat a dead horse, but Saturday night is going to be awesome. We're going to have our executive director, Steph Scherer, there right before the NPRA fundraiser. Steph will actually be doing a free raid training for operators, cultivators, interested patients, same location as the fundraiser. And then Friday night, I guess tomorrow night in Detroit, we'll be having a big Michigan ASA chapter meeting that's open to the public and free. I'm hoping everyone can come out to it.
Excellent. It's always a pleasure talking to you. Fascinating, getting your perspective on things. Thanks so much, and thanks for fighting so hard for the community. We really appreciate it.
Yeah, anytime. Great to be on.
All right, have a great night. We'll talk to you soon. All right, we got 5 minutes left. I'm going to take a quick break, and then we're going to come back and go overtime, and we're going to have Steve Green on, and Terry, you're waiting. We're going to come back right with you right after this short, quick break. We'll be right back.